Okay, let's get back on the job. Cardiovascular case 1. We are looking at a AAA case. A 75-year-old man visits his physician complaining of lower back pain. He has a history of hyperlipidemia and hypertension. On physical examination, he is obese and has moderately limited range of motion of the back. MRI shows that the abdominal aorta is dilated to 4 centimeters, 200% its normal size. What is the most likely diagnosis? Abdominal aortic aneurysm, or AAA. What are the major branches of the aorta below the diaphragm? Blood flow to the major organs is of special concern with a AAA. The inferior phrenic arteries, celiac trunk, middle suprarenal arteries, renal arteries, superior mesenteric artery, testicular arteries, inferior mesenteric artery, lumbar arteries, and the common iliac arteries are located below the diaphragm. What is the 3-layer composition of muscular arteries? The tunica intima is adjacent to the lumen and includes the endothelial layer and the internal elastic lamina. The tunica media includes smooth muscle, collagen, and reticular and elastic fibers. The tunica adventitia contains blood and lymph vessels and nerves supplying the artery. An increased risk of AAA is associated with defects in the genes coding for which proteins? Fibrillin and collagen. Marfan syndrome is linked to a mutation in the fibrillin 1 gene. Ehlers-Danlos syndrome results from various defects in collagen synthesis or structure. Both syndromes are associated with an increased incidence of AAA. Once the aortic wall is disrupted, how does coagulation proceed? Exposure of tissue factor in the vessel wall initiates the extrinsic pathway of coagulation. Circulating factor 7 comes into contact with tissue factor, activating factor 10. Activated factor 10 helps convert prothrombin to thrombin. Thrombin then cleaves fibrinogen to fibrin, allowing fibrin deposition and cross-linking to form a clot. The functionality of the extrinsic pathway is measured by the prothrombin time and international normalized ratio, or INR. What are the risk factors for this condition? AAA occurs most frequently in males. Advanced age and smoking are the most common risk factors. Atherosclerotic lesions in the abdominal aorta are thought to increase the risk of AAA. By contrast, hypertension is thought to increase the risk of aortic dissection. Other risk factors for aneurysmal disease of the aorta include aortic infection, trauma, vasculitis, and connective tissue disorders such as cystic medial necrosis, as seen as Ehlers-Danlos syndrome and Marfan syndrome. What are the treatment options for this condition? A small asymptomatic AAA can be treated conservatively with frequent ultrasound surveillance and smoking cessation. Rapidly expanding aneurysms, or those greater than 5.5 centimeters in diameter, require surgical repair.